Hello. Hello. Am I speaking with Mr. John? Yeah, that's correct. And how may I address you, sir? You can call me John. Alright, John. My name is Monica and I am a registered nurse from the hospital where you were recently treated. And I've been sent here today to check your progress and provide wound care. Is this the right time to speak with you? Yes, nurse. Sure. Alright, John. Before I proceed further, I would like to ask you a couple of questions to understand your situation better. May I? Yeah, sure, nurse. Okay, John. So, how have you been since your discharge? It's certainly good to be back home, nurse. I don't have much energy to move around these days. I'm tired all the time and I don't feel like eating at all. I see. So, what you're saying is that you feel tired often with lack of energy and you don't feel that hungry as well. Am I right, or would you like to add something to that, John? Yeah, that's right, nurse. Well, try not to worry, John. What you're experiencing is completely normal after surgery. With that said, a nutritional diet every day is something that can aid your recovery and build up your strength. So, could you tell me about your diet? Yeah, sure, nurse. I have a small breakfast. Um, I eat a toast and I have a coffee. I also eat half a sandwich for lunch. I usually have ready cooked meals that I microwave for dinner, but I can only eat a couple of mouthfuls. I see. And how much fluid do you consume every day, John? I think I drink plenty of water, nurse, about 8 glasses, and lots of cups of tea also. Well, that's good, John, but I'm afraid we'll need to increase the nutrition level in your diet to increase your energy levels. I would suggest you eat nutritional high calorie foods and supplemental nutrition drinks. I would give you a list of such food items. Would that be okay, John? Okay, nurse. Now, I understand that you don't feel like eating much, so I would advise you to eat food in small quantities, but as many times as you like. You should also eat the food that you prefer to eat, but with an increased nutritional value in them. Will you be willing to do that, John? Okay, nurse, I'll do that. Could you also tell me if you're experiencing any issues such as pain or fever? No, nurse, I don't have any pain or fever. How about swelling? None. Okay, could you tell me if you're sleeping well, John? Mm, well, nurse, I think I'm sleeping fine, nurse, but I think I feel tired all the time. I see. If I were in your place, John, I would have been worried about the same. But like I said earlier, with time and a nutritional diet, this tiredness will definitely subside. Now, do you have any other questions or concerns that I can answer for you, John? No, nurse. I don't know. It just seems like I'm tired all the time. And I don't have an appetite as well. I'm just really worried about it. I think maybe I should get some tests done just to check if I have, if I still have some sepsis left, maybe. Well, I can understand why you might feel that way, John, but having looked after many patients of mine, I can assure you that the tiredness and loss of appetite that you are experiencing are some of the most common symptoms that patients experience while they are recovering from sepsis, which is why I am confident that you are recovering at the right pace and there is nothing to be alarmed about. Okay, John? All right, nurse, if you say so. All right, John. Now, let me tell you what I will do next. I will first check and redress your wound, after which, I will check your vital signs and we'll discuss the time for your next doctor's appointment as well. Is that okay, John? Okay, nurse. Now, may I check your wound, John? Yeah, sure, nurse. Okay, John.